Hello, good evening, and welcome to this conversation. I hope you can hear me. Please tell us where you're watching us from, and today I have a guest for you. As usual, today's conversation is brought to you by Ayo and MTN. Now, I was supposed to run a competition for you, but I won't be able to because of some technical challenges that I have faced today. So we've had some serious technical challenges. However, last week we spoke about Ayo as our sponsors, and they are still sponsoring this program today. So what I'll do is that we were supposed to run a competition for you today where some of you were supposed to win 100 kwacha worth of talk time if you're on the MTN network. But that competition won't be possible because of some technical challenges that we have faced. But we think that we can either run the competition during the week or we will run the competition at the next segment of Ask Dr. Mjizet Sunday. Now, today again, courtesy of Ayo, we are bringing you a conversation around fibroids. Now, the conversation today, I'm not by myself. So today I'm not alone. I have a guest with me, and I've brought you a very accomplished gynecologist to discuss with us the problem of fibroids. And I hope that you'll be able to also ask questions along the way, and then we'll be able to, go on. Now, given that you are here, I would ask you to, if you're on the MTN platform, just go and check Ayo. It's an insurance product by MTN. Just dial *296# and you get all the information from there. However, like I said, we were scheduled to run a competition for you, but we've had serious power outage where we are, and as a result, we were unable to run that competition for you today. Without wasting time, let me bring you our guest for today. Now, I hope you have questions because we don't bring you guests that many times. So to the guest that I'm bringing you tonight, guys, please ask questions because she's a subject expert on fibroids. And I hope that we'll have a very, very interactive session, courtesy of Ayo and MTN. So without wasting much time, let me bring in my guest, Dr. Luea. Good evening.
Good evening, how are you?
I'm well, doctor. Good to see you.
Great to be here, thank you.
Can you hear me?
Yes, I can.
Can you hear me, Doc?
Yes, I can hear you. Can you hear me?
Can you hear me, Doc?
Okay.
Right, I can hear you loud and clear.
Okay, I needed the headset.
All right. So, Doc, I promised. Right, excellent, Doc. So we promised you needed the headset, right? So, Doc, we promised people tonight that we will discuss fibroids. Now, before we proceed, could you just kindly, be so kind as to tell the people, tell the audience who is Dr. Luea, so that, I didn't want to introduce you myself, lest I leave out something. So kindly introduce yourself, Doc.
All right, so my name is Dr. Mwansaket Luea. Well, commonly known as Dr. Katie. I'm an obstetrician gynecologist and currently a lecturer at the University of Zambia School of Medicine. I'm also an honorary consultant at the Women and Newborn Hospital, which is part of the University Teaching Hospitals. Thank you.
Right, Doc. Now, of course, let's start from the beginning. What are fibroids?
Simply put, fibroids are growths, which most times are non-cancerous, which are found in the uterus, in different parts of the uterus, in short.
All right. So now, when it comes to fibroids, one of the things that people like asking is that what type of cancer are they?
Okay, so in terms of classification as a cancer, they are actually classified as non-cancerous, though occasionally a very small percentage, say 1% of fibroids can turn into cancerous tissues. However, generally they are non-cancerous and they are referred to as being benign.
Right. So now, how common are fibroids, say in Zambian women, for example? How widespread is the problem?
Yeah, so generally, these fibroids are a common occurrence among Zambian women. Those that show up at the hospital, you'd put approximately 1 in 4 women would present with fibroids. However, most women will present with fibroids if they are having problems. Those that are not having problems will not routinely present and then get a diagnosis of fibroids. So at least 1 in 4 women have fibroids.
Right. So are you saying that it's possible for a woman to, as long as the fibroids are not presenting problems, she can have fibroids and not even know that she has fibroids?
Absolutely. And there are many women walking around with fibroids who don't know that they do have fibroids actually.
Right. Now, in what age groups do you find fibroids? Like at what age do they generally develop?
So commonly, fibroids would be found within the age range of 30 to 40, 45, just before the age of menopause. This is like when women at their peak of reproduction, that reproductive age, that's when they are common.
Right. Now, so let's talk about the problems that fibroids can bring and what problems and how do women present with fibroids, especially when they start giving them problems. So when fibroids start giving problems, what sort of symptoms would people expect?
Yeah, so generally the problems that fibroids bring is due to their size and their location. Okay, like I mentioned earlier, a woman who has smaller fibroids, giving her no problems, would not routinely present. However, those that have bigger fibroids, and remember, fibroids can be located in different parts of the uterus. So the commonest of the problems is heavy menstrual bleeding. Okay, because the uterus is generally a small size if it's not pregnant. But when there's a fibroid, the surface area is sort of increased, okay? So meaning there's a little bit more of blood buildup, and when a woman is having periods, they are quite heavy due to the increased surface area. Besides that, the uterus contracts during menstruation, and really those contractions are mild to, expel everything. But then because of the fibroid, which is sort of in between the uterine muscles, okay, because they grow from the uterine muscles, so they're in between, interlaced in there. such that the uterine contractions are also sort of compromised. So the bleeding will be heavy as well as prolonged. That's one. Then the other issues would be pain. Like I already mentioned in terms of the contractions, the uterus has to work hard to try and contract and bring out that menstrual blood. So the pain will ensue. Other things would be the pressure, okay? If the uterus, the fibroids are quite big and they're right on top of the bladder, you know the uterus is above the bladder, okay, in the arrangement of the organs. So that pressure on the bladder also may cause a woman to bleed, to go to the toilet more frequently, even when the bladder is not full, because of that effect of the pressure of the fibroids. Yeah, so mainly women would present with prolonged menstrual bleeding or sensation of a mass. You know, sometimes women are even thought of being pregnant due to that bulge of the, you know, abdominal wall due to the uterine growth.
Right. But how common is anemia in women who present with fibroids?
Yes, so depending on the symptoms, those who are presenting with a heavy bleeding, most of them are anemic, and it actually impacts negatively on their treatment. And remember, I said that the larger fibroid would increase the surface area of the uterine lining where the menstrual blood will build up. However, there's also another type of fibroid which is just right in the lining. So for some, it's increasing the surface area, but for some, they are right in the lining of the uterus. So also those are notorious for bleeding. They may be smaller, but bleed quite a lot. So those who are bleeding a lot many times present with anemia because you know, there are normal ranges for blood loss for a woman who's having her menses. So anything that is going beyond her menstrual cycle of, say, 5 days to 7 days would cause anemia. And some women actually would present with symptoms of anemia before they even know that they have fibroids.
I see. Now, so maybe just to summarize, if I heard you right, and for those who may have just joined us, you are saying that the symptoms that people would come with, or the complaints that they would come with, is prolonged periods, painful periods, frequent urination because of pressure on the bladder. Some may present with anemia. Now, there's another issue again with fibroids. Fibroids and fertility. What is your comment on that?
All right. So on the symptoms, just to add on, some women may have painful sexual intercourse by virtue of the location of the fibroids. Right. Then regarding infertility, women with fibroids are able to conceive. However, it depends on the location of the fibroid. For instance, if the fibroid has grown such that it, you know, probably there's a problem with one tube, and the one tube that is surviving, that is a fallopian tube, of course, where fertilization takes place. If there is that mechanical blockage on the fallopian tube, then definitely there will be no contact between the ovum and the sperm. So those are rare cases when fibroids may cause may be associated with infertility.
How about issues of miscarriage or abortion or loss of the pregnancy? How frequent is loss of pregnancy in women who have fibroids? Can a fibroid affect the viability of a pregnancy? Can someone lose a pregnancy because they have a fibroid?
Yeah, so miscarriages and fibroids would be due to improper classified under abnormal placentation. Okay, because we know that after fertilization, there's implantation that takes place in the uterus, and then baby grows from there. So the fibroid has no blood supply within itself, which is rich enough to support, okay, that growing baby. So if the placenta wrongly implants on a big fibroid, then that way it will not be viable and it may lead to miscarriages.
Let's talk about delivery. So if a woman has fibroids, what challenges would they have in terms of delivering the baby? Let's assume she's delivering the baby normally, vaginal delivery. What challenges would fibroids bring in that type of scenario?
Okay, so just to build on with a non-pregnant uterus, where the surface area and also issues with contraction of now that's a uterus that needs to expel the baby. Sometimes fibroids may cause a prolonged labor because the contractions are not so effective, okay, because there are those muscles that are in between the uterine muscles. So the contraction is not in sync and usually may cause prolonged labor. That's one. The other thing is that it may cause obstruction. If the fibroid is on the cervix, which is the outlet for the baby, okay, that means that the baby will have no passage and the normal birth would be very difficult. Besides that, again, the issue of the uterus contracting. The uterus needs to contract both during labor to expel the baby and also afterwards so that the uterus is going to its normal size. Yeah, so at this point, again, women then get more predisposed to bleeding after delivery. So ideally, in the management protocol, when you have a woman who's got fibroids, after they deliver, we actually give them some medication to help contract the uterus before they could even bleed more as a routine, other than waiting for them to bleed. So those are some of the challenges.
Right. Now, Dr. Ware, I'm sure some of the people out there are wondering, so what causes fibroids? Like, what are the risk factors? In what sort of woman do you expect to find fibroids? Who is likely to develop fibroids, in other words?
Okay. So fibroids are hormone dependent. There are two key hormones which are produced by the ovary, which are part of the menstrual cycle, regulating the menstrual cycle. And these hormones are called estrogen and progesterone. So they sort of depend on these hormones to grow, okay? So some of the risk factors, okay, when one has a risk factor, it doesn't mean that definitely they will have fibroids or not, but it just means that chances of them getting fibroids are higher, okay? So one of the things is age, like I gave the age range of between 30 and 40. Um, Other risk factors include those women who've not had a child before, women who are obese, smokers, increased alcohol intake, and of course, studies done in the Western world put Black women at increased risk of having fibroids.
Right. Thanks, Doc. Very shortly, we'll be going into taking questions from the people who are watching us. And before we start taking questions from people who are watching us, a bit of a mention that this particular segment of Ask Dr. Mjajati Sunday has been sponsored by IO. IO is a microinsurance company that is owned and operated by MTN. And like I mentioned at the beginning of the program, today we were supposed to run a competition where you were supposed to have won 100 kwacha talk time for at least 3 people. But because of a technical challenge, we'll run that competition at another time. However, we need you to note that with regards to IO, if you need details, if you're on an MTN or you're an MTN subscriber, dial *296# and follow the prompts and get all the details and the benefits of IO. It's basically an insurance policy. Now, Dr. Mbe, treatment. Are fibroids treatable?
So that's a mouthful of a question, even though it's, I mean, you just said it in a sentence like that.
I apologize.
Yeah, so mainly
So,
the
Dr.
aim.
Leah, are fibroids treatable? Before we get into the treatment or management modalities, we want to know whether fibroids are treatable or not.
I would say that I would say yes and no. Okay, so in treating fibroids, it's all about the desires of a woman and circumstances around that. So treatable they are with different modalities, but mainly you want to, it's control of symptoms. Remember we said they are not cancerous, so it's really control of symptoms. But for women who need all the way, who needs to go all the way, yes, they definitive treatment.
Okay. Now, before we go into details of the treatments and other things, we want to give more time to our followers and listeners. Right now, we are being followed or listened to live both on Facebook and YouTube. So if you're a YouTube subscriber, welcome, and also welcome to our Facebook followers. So now we'll take questions, Doc. So I will read out some of the questions so that you'll be able to explain some things. Let me see which questions we're going to start with. There's this question here. This question from Chris Tater, and his question is, Doc, are fibroids only located in the uterus, or is there any other organ that can have fibroids?
So the fibroids grow in the myometrial tissue. This is the tissue that is found in the uterus. That's where they are found. However, there is a certain type of fibroid, which is referred to as a pedunculated fibroid or a migrating fibroid. This is a fibroid which gets cut off from its original place or area where it was growing within the uterus, and then falls off elsewhere and starts getting its blood supply from that place. So like it has migrated from its original place. Otherwise, they are dependent on the tissue that is found in the uterus, where there is that effect of estrogen and progesterone, the hormones that we spoke about earlier.
Right. There's a question here from Chilomba. Samkonga Zulu, Chilomba Zulu, Samkonga. Her question is, do fibroids affect the growth of the baby during pregnancy?
So really, the fibroids, depending on size and location, we have had babies who may have, say, growth is compromised if the fibroids are too big, okay? Because then the baby and the fibroids are competing for space in the uterus. So yes, especially with very big fibroids. Sometimes you even find that maybe a foot or probably a hand or something is not moving properly because it was in one position and the baby couldn't keep on moving within the uterus. It's like fixed to a certain position. So that's possible.
Interesting question there, Doctor. There's a question from Wezi Saili. The question is, can a virgin have fibroids?
Oh, yes. Any woman is prone to having fibroids. Fibroids are not sexually transmitted. They grow within the uterine muscles. So a virgin can have fibroids.
Okay. So a virgin can have fibroids?
Yes, please.
All right. The question here from Jocelyn Munkombwe. Her question is, Doc, do fibroids cause severe backache?
So yes, depending on location, that is a possibility. Pain has been associated with fibroids, backache, because the nerves okay, which supply the uterus. Some of them have an effect on the back. That's why you see when a woman is in labor, they will start complaining of backache. So the pain is really referred from the uterus to the back. So that is a possibility, yes.
Another very interesting question, Doc. This question is from Juliet Peary. She's asking, is it safe to remove a millimeter size fibroid which is located in the uterus?
I'm sorry, Doc, you were kind of breaking. I missed the question.
Okay, so there's a question here that is it safe to remove a fibroid, a small fibroid which is located on top of the uterus?
Okay, so I know that we didn't go into the management of fibroids, but there are certain things that we look at, of course, in consultation with the patient, right? We look at the age, if they're having any symptoms, what their fertility desires are, and what sources are available. So I can imagine that that small fibroid on top of the uterus is really small and it doesn't compromise the quality of this person's life. I would leave it alone.
Excellent. Doc, there's another interesting question here. This question is from, I can't pronounce the names. You know, we are followed here by international people as well. Now, the question is that which site or which location of fibroids is more likely to cause miscarriage?
Okay. So the fibroids which are located right underneath the endometrium of the uterus, okay, that area where there is that buildup of the menstrual blood during a woman's menstrual cycle. So those that are right below are more likely, those that are closer to the uterine cavity are more likely to affect, of course, issues around miscarriage. Remember, I mentioned that if there is a placenta implantation over a fibroid, so it can only be a fibroid that is closer to the uterine cavity. Otherwise, those that are on the outer, the impact is really minimal, if at all there is.
Doc, there's an interesting question here. Let me see if I can put it up. This one is very interesting. Yes, this one. Jocelyn Hazala, she's asking, Doc, do family planning pills cause fibroids? I think, Doc, I'm going to beg you that at some point you would need to come back for us to come and discuss family planning, especially contraception and things like that, because there's a lot of questions around contraceptives. But let's deal with this question here. Do family planning pills cause fibroids?
Okay, so family planning pills studies, you know, some of these associations, causation or no causation, we rely on available data and available information. So research has shown that family planning pills have got no effect on contraception. Actually, some of it, we even use it to control the symptoms of fibroids.
Okay. So which symptoms of fibroids may be controlled by that, where you may end up giving family planning pills to control?
All right, so I can probably give an example of a combined oral contraceptive, and this is commonly known as Safe Plan. Yeah, Safe Plan and that family of the 28 pills, which have got a combination of estrogen and progesterone. Okay. It is, we use it to regulate the menstrual cycle. Remember, we said that women bleed a lot, especially those with big fibroids, okay? But the family planning pills, the Safe Plan and those in the family of combined oral contraceptives, they help to regularize the cycle, because in the 21 days that a woman takes those pills, their hormones are under control. So they will not bleed, they will not have their period whilst they are on that on the 21 pills. But when they go on the pill 22nd, pill number 22, those which are brown, which are really a placebo, and that's iron, that's when the period is on. That is the 7 days. So once they go back to another pack of the family planning pill, the period would have stopped. So actually, inani would have stopped, and then they go on another cycle. So the bleeding is more controlled. Instead of the woman bleeding for 2 weeks, you reduce that. Besides that, for those who come with severe anemia, and we need to probably, the ultimate treatment, the best treatment for this woman is, say, surgery, but their blood levels are too low. We even give them maybe a 3-month cycle of the contraceptive pill without that period of bleeding, so that for 3 months, that woman doesn't bleed, and that way their HB builds up. So that's how we use these contraceptives in controlling symptoms of fibroids.
All right. Now, before we go into the next segment of this conversation, I'd like you to deal with this particular question right here. Let me see if I can put it up. Yeah, this one. Are fibroids genetic or anything to do with genetics?
Yeah, so like causation, yes, there's a genetic predisposition. And in our earlier risk factors, we actually talked about the Black race having a higher chance of having fibroids. So yes, there's a genetic predisposition to fibroids.
So they are genetic. There's a genetic component to fibroids. Right, Doc, can you still hear me?
Yes.
All right, Doc. Let's go into the second segment of our conversation. Doctor, walk us through the treatment options of fibroids. Are fibroids treated before we go to the next segment of our questions? How are fibroids treated? What are
Okay. So the mainstay, what I would like to emphasize in this conversation that we are having, is that management of fibroids depends on age, someone's age, what symptoms they have, desires for fertility, and of course, how do they impact the quality of life for someone, okay? So to start with, I'll even actually bank on the question that someone asked earlier about a small fibroid on top of the uterus. In those, the management is conservative, really. If it's not causing any problem, it's just a wait and see thing, if there's no problem. However, where there are problems, say, because now you are going symptom by symptom, there's hormonal and non-hormonal treatment, okay? So non-hormonal treatment, usually it's over-the-counter medications which help in blood clotting, okay? One of them would be an example of tranexamic acid that you can buy over the counter to just help so that the bleeding is not prolonged, okay? And then depending on the severity of the symptoms, how bad someone is, then you escalate the management plans, okay? The hormonal aspect, I talked about the combined oral contraceptive pill. It's used for management. Progesterone only pill, which is usually referred to as a mini pill. Some women who've had babies before and they are breastfeeding and on contraception, they know the mini pill. It's a small, tiny pill which helps with the bleeding. Under hormones, again, we have what is called the loop or IUCD. So the loop has got two types. There's one which is called a copper T, whereas the other one is referred to as a hormone embedded a loop which has progesterone on it. So that one which has a hormone on the loop, it can be inserted, okay? Because it releases progesterone locally within the uterus, and it's known to control bleeding very well, build up someone's HB, and their anemia, goes with that sort of management. So these are all non-surgical modalities, and usually these are the ones that we want to start with before you go now further to other surgical modalities. So under surgery, we have, of course, open surgery and closed surgery. I know that now more and more health facilities within Zambia are able to do surgeries, say removal of the fibroids only with the uterus intact. So this can be done under, closed surgery, laparoscopically. Someone is watching through a camera, then they're able to crush the fibroids and then suck that out. Other places, it would be an open surgery, but also, patients should qualify sort of a clinical assessment to undergo these sort of surgeries. So once the fibroids are removed, the uterus is intact and then it's repaired. For sometimes you may have to go all the way and remove the uterus if it's giving so many problems, which is sort of like the definitive management. So that's under surgery. Now locally, we call them newer methods, which would include things like uterine artery embolization. Okay, so in this case, it's like you just radiologically guided, you just block off blood supply to the fibroid and then it would shrink. The other ones are under MRI guided, whereby you sort of burn the fibroids with high radiation, and these are sort of a bit more high tech. But generally, just to gloss over, these are the options that are available for treatment of fibroids.
Thank you, Doc. Now, related to treatment, there's a question here from Maureen Aongola. So her question is, Doc, what are the effects of removing fibroids in relation to conceiving?
Okay, so there are two things here. Mostly women who prefer to have their fibroids only removed and conserving the uterus, it's for fertility reasons. Okay, so it's a careful procedure where you take out as many fibroids as you can, so that you reduce the impact that I talked about earlier. However, what is key is that when the uterus is healing after surgery, the uterine cavity should not come together, should not heal on each other. The cavity inside should remain intact, or if there is a breach, that should be reported. What you need as much as possible is that the uterine cavity is intact while the fibroids are healing, while the uterus is healing, because this sometimes the procedure is quite extensive. You have so many fibroids and you need to save this uterus. But the complication can be that during healing, there is that fibrosis which forms within the uterine cavity, and that sort of tissue should not be there. So it means there will be problems in implantation. So you find that most surgeons are very careful that the uterine cavity is patent as much as possible during these surgeries and post-surgery.
Another question, Doc. Do fibroids eventually shrink?
Oh, yes. So like I mentioned, fibroids are commoner in a reproductive age where you have women having menses. When a woman attains menopause, usually fibroids tend to shrink. And that's why also age of a woman is very important in deciding her management. If it's a woman who's attained menopause, you are not so worried about having to remove the fibroids, because the research supports that those fibroids will eventually shrink, because a woman who's postmenopausal, these hormones are not as high as a woman who's within the reproductive age.
Okay. Now, Does a feeling of movement in the abdomen when a woman is not pregnant indicate fibroids?
Not exactly indicating fibroids. Sometimes it's just bowel movement. I think that may be another topic of interest to discuss about a pseudocyesis. A woman feels that they are pregnant and they go all the way to 9 months and actually there is nothing. So that is not equal to fibroids. Though fibroids, when you know you have them, you may have that sort of feeling in your abdomen, but it's not diagnostic that any kind of movement that you feel is fibroids.
There's a very interesting question here, Doc. I think I like this one. This is from Wancha Bishonga. Her question is, can new fibroids come up after operation? Basically after surgery. Can new ones form?
Oh, yes. So that is, as long as the hormone is there, as long as the uterine tissue is there, fibroids can still be there. But usually what happens is that during surgery, especially in women with so many fibroids and small ones, some are too small to remove during surgery, or some you can't see them with the naked eye. Okay, so after some time, those fibroids which were smaller at the time that you did the surgery, they'll also grow. So sometimes this is referred to as fibroids regrowing after removal. So it's not actually the ones that were removed that regrow. It's just that not everything was removed and there is still potential for the uterus to grow more fibroids. So yes, that's possible.
Doctor, there's a complaint here. I don't know if you are going to deal with it, but let me present the complaint. The complaint is this one, Doctor. It's from Catherine English Peary. Her complaint is that, but why do doctors opt for surgery only when there are all these options, like the options you've mentioned? My doctor never mentioned other options other than surgery. How do you address that complaint?
Well, it's a bit difficult for me to really give an opinion about that, but I'll just say it would be interesting to know what sort of symptoms the patient had, what their age was, and what other desires were in that circumstance, and also to know what things were available to them at that point that they were being treated for the fibroids. Remember, some of the things, as much as they could be ordered, but in our setup, like uterine artery embolization, it's barely a year or two since public institutions started using them. So it's about what is available at the time that the patient presents. Yeah.
Another question. I think tonight we have very, very good questions. Rejoice Zulu Njovu wants to know, Doctor, how do you know that you have fibroids? Like, how can a woman start suspecting that she could have fibroids? How would she know?
All right. So it takes us back to the symptoms that we spoke about. Okay. Every woman has knows how her menstrual cycle is. Yeah. If I bleed for 4 days and I know, you use so many pads in a day, all of a sudden your pattern changes. You start bleeding for 7 days and you're using more and more pads. Sometimes you also can see that there's a bulge on your abdomen. You go sometimes do a pregnancy test, you find that it's negative. Okay, so it's the symptoms that would actually bring up this diagnosis. And that's why I even mentioned earlier to say many women rather are walking around with fibroids, but they don't know because they're not causing them any problems. Okay, so there are these telltale signs to say I could be having fibroids. So on examination, your doctors can see that you have a growth, and then you go for an ultrasound scan or any other scan to just confirm what those growths are. Yeah.
Now, doctor, here's another very interesting question for you. This is from Malinga. Doctor, what kind of tests do you do to find the presence in someone who's not showing symptoms.
What kind of test do we do to find what?
What kind of test do for you to find fibroids in someone not showing symptoms?
All right. Okay. Thank you. So an ultrasound scan may be ordered for many things. Okay. I will give just a basic example. Someone who's pregnant, it's a routine, it's a must. They have a certain set minimum number of ultrasound scans. So you order a scan for this pregnant woman, and as they go for a scan, the sonographer will see that there is, of course, the pregnancy, and then they will see a growth, and they know how to characterize that. So that's one way. An ultrasound scan, which is meant for something else, and then you find a fibroid. It's something that we call incidental finding, okay? And then, of course, fibroids undergo some changes. And like we mentioned, you find that so you find that you have incidental findings. Sometimes you send them for an X-ray. If there is a calcification, you find that an X-ray which you are taking for other things for the bones, it shows that there is a fibroid or a calcification somewhere. So it's just investigations ordered for something else.
Right. Now, there's a question here that I must ask, Doc. Let me look for it. There's a question I must ask. It relates to, let me find it. Yes. Doc, is it true that fibroids come up because we avoid having babies during our reproductive age?
Yes, that is a very well-known risk factor for fibroids. Women who've never had a baby before, those that have not conceived. Okay, remember we mentioned that the fibroids are dependent on two hormones which sort of regulate the menstrual cycle. Okay, that is estrogen and progesterone. Right. So during pregnancy and breastfeeding, there is an interruption in the levels of these hormones. Okay. However, in a woman who has not conceived in her reproductive life, there is no interruption of these hormones. That's why you find that they are commoner in women who've never conceived before. So that's correct.
Now, related to the same, there's another question that is connected to this one. And here's the question. The question is, Doc, therefore, this question is from Margaret. Margaret is asking, it's a very short question, but related to the one that came earlier. Does conceiving help in managing fibroids?
Yeah, so ultimately, just as I have hinted on, that interruption in the levels of estrogen and progesterone helps when one is pregnant and when they are breastfeeding.
So what happens to fibroids when someone gets pregnant? Do they get smaller? Do they stop giving problems? What happens?
So many times the fibroids in a pregnant woman would be quiet. Okay. However, for some, because the uterus grows almost 10 times, it's 10 times and more its normal size when one is pregnant. So because there is that increase in blood supply to the uterus, the fibroids also ride on that increased blood supply to the uterus, and then they may grow a bit bigger during pregnancy. And one thing that they may cause in pregnancy is pain. Because they are growing so fast, their inner part starts to die off because it can't cope with that rapid growth. So there is what is called a red degeneration, where there is that severe pain because of that part inside the fibroid, which is not receiving enough blood supply. But simply a paracetamol is able to control that pain of fibroids during pregnancy.
Doctor, we are almost winding up. There's an interesting question for you, this one. Can fibroids cause menstruation to stop?
Oh, actually, the fibroids would worsen the bleeding of menstrual bleeding, not stopping that will not stop. Unless it's causing obstruction, but those are other problems. I think simply put, fibroid would not stop menstruation. Then there should be other things that people should look out for.
All right. All right. Now, let me ask you the last question as we close. The question, Doc, is this one. Doc, can you easily distinguish between normal menstrual pain during menstruation and the pain that is due to fibroids?
So the mechanism of the pain is the same, okay? Some women, even when they don't have fibroids, they have such severe pain, okay, which could be due to other causes. Women with fibroids may also have pain, but the thing that comes, that is cross-cutting, is that it's the uterus contracting. So severity may differ from woman to woman, and also the pain threshold of this woman. Otherwise, the cause and the cause of this pain is usually that contraction of the uterine muscles.
Doc, I know I said that was the last question, but we can't avoid this particular one. This one we can't avoid it. Let me just ask it. Because I know these ladies, when you leave, they'll start asking me to answer these questions. Now, this one you will have to answer. Doctor, can herbs finish fibroids, or can herbs make fibroids disappear? Do you have herbs that make fibroids go away? Because there are so many adverts around that we see. Come and drink this, it will disappear, your fibroids will disappear. Are there herbs that make fibroids disappear?
Well, I think, like you have mentioned, there are so many herbs, and that's sort of really a statement. But what I can say is that nutritional benefits, nutrition is important in prevention of fibroids, okay? I mean, it's the same things that we talk about: healthy eating, vegetables, fruits, enough water, exercise. Those are the key things. Otherwise, herbs are really, they are just supplements to boost your immune system, to boost a number of things. But I wouldn't take that as herbs are going to finish the fibroids.
Right. Doctor, I want to thank you most sincerely for coming through. I know you have a very busy schedule, and it would be nice to have you come back one of these days to discuss other issues that are of interest to women who follow this page, particularly issues to do with gender-based violence, sexual harassment, issues to do with contraceptives. I know you are experts, know this subject, so I'm hoping that we can make time during your busy schedule to bring you back on this show to talk to us about these things. Now, as we close on this topic of fibroids, what is your take-home message to everybody who was following this conversation, to both men and women who are here? What is your take-home message?
All right. Just to finalize, I think women should understand that fibroids are common and there is help out there. There is no need to go around circles. Once you realize that you have issues related to your menstrual cycle, prolonging, heavy bleeding, don't hesitate to seek medical attention. And of course, one of the other things that you should do is you screen for cervical cancer, because this bleeding can be due to a lot of things. But the bleeding that is due to fibroid is manageable. Every woman needs to live her life to her full potential. You don't have to have a compromised quality of life because you have not been able to seek medical attention. So it's important that when you see something unusual about your body, and especially bleeding, which is not your usual bleeding, please seek help. There's a lot of options and a lot of alternatives that could help you lead a better life in terms of your health. To the men, it's just all about supporting women. You know, some people think it's witchcraft, or why is my wife having fibroids? What is this now that has come? All that women need is support and help them seek treatment for fibroids. So support is there, symptoms can be controlled. What we just need to do is seek treatment early. Thank you very much.
Thank you very much, Dr. Luea. Enjoy the rest of the evening and thanks for making the time. And good night.
Thank you very much and good.
Right, ladies and gentlemen, there you have it. We just had a conversation with Dr. Luea on fibroids, and this conversation was brought to you courtesy of IO. IO is an insurance company which is run and operated through MTN, and this is an insurance service that is available to MTN subscribers only. So dial that number, *2# and enjoy the benefits if you're an MTN subscriber. Ladies and gentlemen, right now, please do share this video, because if you follow this page, then you're an equal partner to this mission that we are on to ensure that our citizens are healthy and prosperous. And we are doing that through information dissemination. So do click the share button. Now, if somebody has missed this video, please encourage them to subscribe to our YouTube channel. This video will also be there on our YouTube channel. So if you also want to listen again, just subscribe to our YouTube channel. You should be able to enjoy this content all over again. So, ladies and gentlemen, that said, it is good night from me, and we shall see you tomorrow. All right.